If you or someone you love is experiencing leg cramps, don't just chalk it up to old age. Welcome back to our channel, where medical topics are made easy. Today we're going to talk about warning signs when cramps in seniors can signal a bigger problem. One common issue many seniors face is leg cramps. These sudden involuntary muscle contractions can be uncomfortable and even debilitating in some cases. While these issues can be uncomfortable, they're usually not serious and can be resolved with rest and fluids. However, there are certain situations where leg cramps may indicate something more serious going on. But did you know that leg cramps in seniors may sometimes signal an underlying condition? There is no hard and fast rule about how many times one should visit a doctor for leg cramps. It depends on the severity and the circumstances. However, here are some guidelines. By understanding the causes and recognizing the symptoms, you can take proactive steps to protect your health. Let's discuss some of the conditions that can cause leg cramps and their potential seriousness. This can cause swelling and discomfort in the lower legs and ankles. CVI can be a serious condition leading to complications like skin ulcers and blood clots. Fortunately, there are treatments available to help manage the symptoms of CVI and prevent further complications. Myasthenia gravis is an autoimmune neuromuscular disease that can cause muscle weakness and fatigue. Leg cramps can be a common occurrence, especially among seniors. However, it's essential to be vigilant and recognize the warning signs that indicate a more serious underlying condition. Whether it's peripheral artery disease, chronic venous insufficiency, deep vein thrombosis, restless leg syndrome, or neuromuscular junction disorders, each condition has its unique set of symptoms and potential complications. By staying informed and proactive, seniors can take charge of their health and well-being, ensuring that leg cramps don't hinder their active and fulfilling lifestyle. This condition can make it difficult to walk and increase the risk of falls in seniors. We believe that knowledge is the key to better health outcomes, and share it with others who may benefit from this information. Don't forget to subscribe to our channel so you never miss any of our informative videos. Stay healthy and keep learning. That's why we create informative and engaging videos on a wide range of medical topics, including those that may be challenging to discuss otherwise. Our goal is to empower individuals like you with the information you need to make informed decisions about your health and well-being. We cover a variety of topics from common health concerns to the latest medical advancements, ensuring that there is something for everyone. Whether you want to learn about nutrition, mental health, diseases, or preventive care, we've got you covered. Our platform is designed to be a valuable resource for anyone looking to improve their health literacy. We strive to break down complex medical concepts into easily understandable language, ensuring that our viewers leave our channel feeling informed and empowered. While there is no cure for myasthenia gravis, there are treatments available to manage the symptoms and improve quality of life. Seniors diagnosed with this condition should work closely with their healthcare team to develop an effective treatment plan. It's important for seniors to be aware of the signs and symptoms of CVI and to seek medical attention if they occur. If you have never had leg cramps before and you are now experiencing them frequently, it is a good idea to schedule an appointment with your doctor. DVT can cause symptoms such as leg cramps, swelling, and redness. RLS can be more common in seniors and can disrupt sleep patterns, leading to fatigue and other health problems. While RLS is not a serious condition, it can significantly impact quality of life. There are treatments available to help manage the symptoms of RLS and improve sleep quality. Seniors who suspect they may have RLS should consult with their doctor for a proper diagnosis and treatment plan. This condition can be serious as the clots can travel to the lungs or heart, causing a pulmonary embolism or stroke. However, it's important to note that DVT is relatively rare, occurring in approximately 1 in 1,000 individuals over the age of 60. While DVT can be serious, early diagnosis and treatment can help prevent complications. Seniors who experience symptoms of DVT should seek medical attention promptly. This can cause symptoms like cramping, numbness, and pain in the legs, particularly when walking. PAD is a serious condition because it can lead to complications like heart disease and stroke. If left untreated, it's important to note that PAD is a significant issue affecting many seniors. In fact, approximately 12 to 20% of people over the age of 65 have PAD. This means that millions of seniors around the world may be dealing with this potentially serious condition. The good news is that there are treatments available to manage PAD and reduce the risk of complications. By staying informed and taking the necessary precautions, seniors can continue to enjoy an active and fulfilling lifestyle. Also, if the cramps are severe or persist for more than a few days, it is important to seek medical advice. Additionally, if the cramps are accompanied by other symptoms such as shortness of breath, dizziness, or swelling in the legs or ankles, you should contact your healthcare provider promptly. Remember, while leg cramps are common, persistent or severe cramps can indicate an underlying condition that requires treatment, so don't hesitate to reach out to your doctor for guidance. This could be an indication of a condition known as compartment syndrome, which occurs when there is increased pressure within a muscle compartment that can restrict blood flow and cause cramping, numbness, and tingling. First, try to remember when the cramps occur. Note down the frequency, duration, and intensity of the cramps. This will help you and your doctor identify potential triggers and develop an effective treatment plan. Next, pay attention to any other symptoms you may be experiencing, such as swelling in the legs or ankles, changes in skin color or texture, or difficulty walking. These details can provide valuable insights into the underlying cause of your leg cramps. Finally, don't hesitate to ask your doctor questions. By working together, you can find ways to manage your leg cramps and improve your overall well-being. Compartment syndrome is rare but can be serious if left untreated, so it's important to seek medical attention right away if you experience this symptom. It's important to pay attention to these warning signs so you can take the necessary steps to protect your health. If cramps are happening regularly, it might suggest an underlying issue like peripheral arterial disease, which affects blood flow to the limbs. PAD can lead to symptoms like cramping, numbness, and pain in the legs, especially when walking. Other conditions that can cause recurring leg cramps include chronic venous insufficiency and deep vein thrombosis. These conditions affect blood flow back to the heart and can cause swelling and discomfort in the legs. If you or someone you love is experiencing leg cramps, don't just chalk it up to old age. There could be an underlying condition that needs attention. Keep watching to learn about the warning signs to look out for. And don't forget to like and subscribe so you never miss any of our health insights. As we age, we all want to stay healthy and active. But sometimes aches and pains become a part of our everyday lives. Leg cramps can be caused by a variety of factors such as dehydration, electrolyte imbalance, and poor circulation. One warning sign that leg cramps could be signaling a bigger problem is if they occur suddenly and severely. Another warning sign to watch out for is persistent or recurring leg cramps. Now let's talk about how often is it okay to see a doctor for leg cramps. When dealing with leg cramps, it's important to keep a few things in mind. Occasional leg cramps may be normal. It's essential to be aware of the warning signs that indicate a more serious problem. Peripheral artery disease, or PAD, is a common condition that affects blood flow to the limbs. Another condition that can cause leg cramps is chronic venous insufficiency, which occurs when blood flow from the legs back to the heart is impaired. Deep vein thrombosis is a condition that causes blood clots to form in the deep veins, typically in the legs. Restless leg syndrome, or RLS, is a neurological condition that causes an irresistible urge to move the legs, often accompanied by uncomfortable sensations. Neuromuscular junction disorders are conditions that affect the connection between nerves and muscles. By understanding the warning signs and seeking timely medical attention, seniors can effectively manage these conditions and maintain a high quality of life. At our channel, we are committed to making medical topics easy to understand. Thank you for being a part of our channel. If you found this video helpful, please give it a thumbs up.